for certain reasons. For instance, a woman who ruptured uterus at delivery, and we as obstetricians, we have to ensure that even though the baby is dead, definitely in utero, that's inside in the womb, she's still bleeding. So the fastest thing that can be done to keep her alive is to remove the womb. And alongside, at times, we may have to remove the ovary. Definitely, when the ovaries have been removed, that means there's no menses anymore. So that is already the next month, she would definitely not see her menses. So it can also happen to women who are on the diagnosed of some cancers, any type of cancer, and are placed on chemotherapy. So it affects the ovaries. So that means that eggs will not be available. Yes, eggs will not be available, and then that is menopause. Then it can happen if they're also undergoing radiotherapy, for which is one of the modalities of treating cancer as well. That is also menopause. So invariably, menopause, as I said it's a Greek word, but anatomically, it just means that follicles are finished. Follicles means eggs are finished. Hmm? And when these eggs, we are born with them, unlike men that continue to manufacture sperm. But for female, we are born with the amount of eggs that we need for our reproductive life. So as soon as we are born with it, we tend to get rid of about 400 to 500 eggs every month. We are born with about 300 to 500,000 eggs when we are born, especially when we attain puberty. It was counted sort of scientifically, and that averagely every woman has 300,000 to 400,000 eggs as soon as they are born. So you now start getting rid of about 400 to 500 every month. That means that only one of the 400, 500 is expected to get fertilized and be a baby. So as soon as you exhaust all the eggs, that is menopause, so to say. So it's actually in stages, because you can see, as I said, the eggs will continue to deplete gradually until it eventually finishes. Exactly when one is above the age of 40, 45, thereabouts, you have less than 1,000 eggs left. So invariably, they can never be optimal. So at the end of the day, you first of all experience irregular menstruation, meaning that, as I said, you said 3 months, I said 12. That 3 months could actually be the preparation. So we have what we call perimenopausal period, we have the menopause itself, and we have postmenopausal period. We